Hi, this is Dr. Kaustubh Mahajan, consultant neurologist attached to Raheja Hospital. So today we'll talk about forgetfulness, dementias, Alzheimer's dementias. Are they equivalent or they are different things? So let's define them first. Forgetfulness is basically we are forgetting things, as simply put. Dementias is a neurological condition where 4 or 5 domains are affected in the brain. One of them is memory, second is language, third is behavioral issue, fourth is executive functioning, and fifth is perception. So, whereas Alzheimer's dementia is one of the common types of dementias in which memory domain is the most commonly affected. So, let me elaborate on this with giving you an example. I am reading a report. I remember that I have to inform this to my colleague. It's an important report for a patient. And I take my phone in my hand, and then suddenly there's a WhatsApp message. I read that. Then there's suddenly a mail pop-up, and I keep getting distracted to these different pop-ups. And then I just keep the phone down once I finish reading these messages. So eventually then in the evening, my friend calls, why you didn't inform me the report? And that's how I remember that, oh, I just forgot. So I think this must be happening with many of us, but this is what is basically forgetfulness. Now, when I go back to my seat and see the report which I had to inform, then that behaves as a visual cue, which reminds me, oh, I forgot to inform you, and then I can retain that lost memory and I can go back and do it. So when you have a visual cue which is helping you to retain the lost memory, it happens in forgetfulness, and this will not help in a patient with dementia. Visual cues will not help. Second important difference is that patients with dementias have no awareness of their symptoms. So they will never complain that they are forgetting things. It will always be the bystanders who will complain that he is forgetting. Whereas a patient who's forgetting things, who's forgetful in simple terms, will always be aware, and he will come to the doctor with the symptom that I am forgetting. He will complain. So knowing this, let's dwell more into memory, which is mainly divided into short-term memory and long-term memory. You know, short-term memory is what we call as working memory, is a part of the hippocampus, which in simple terms is RAM of the computer. And long-term memory is a part of the frontal lobes in the brain, which in simple terms is the hard disk of the computer. So most of the time which we are affected and bothered with is the short-term memory. So remember, short-term memory is at a given time can handle 5 things together. But if there are more things bombarded on it, the short-term memory center, which is the hippocampus, will tend to shift the first thing which it was supposed to do. So as in our case, where the first thing was supposed to do, make an important phone call, was shifted, and other things were given place to. The WhatsApp message, the Yahoo mail message, whatever. So that's why, to reduce your distractions, to improve your focus, that's an important part of retaining proper memory. Now let's talk about Alzheimer's dementia. Alzheimer's dementia is a dementia which is a degenerative condition. Remember, dementias are of many types. There are frontotemporal dementias, Alzheimer's dementias, Lewy body Parkinson's disease dementias. But of this, Alzheimer's dementia is one of the common dementias, and whose primary important risk factor is age. As you age, the chances of Alzheimer's dementia happening more is common. And believe me, even if it is getting symptoms are being shown at the age of 70, the process has started already 40 years prior. So doing things at the early age will help us to get dementia later, rather than when the symptom onset has already started, things may be already late. So let's act now. So what are the things, if I do in early age, will prevent dementia in later life? And these are proven facts. So understand the concept that basically there is not enough clearing of the toxins, which is happening mainly in your sleep and because of a good circulation. And third is by improving the brain reserve. So how these 3 things can be done? Improving the clearance is mainly happening in the sleep. So ensuring a good uninterrupted sleep is important. Second is having a good circulation to your brain. by increasing your physical activity, aerobic activity in the earlier life helps to improve the circulation and clearance. And third is improving the brain reserve. That is mainly by making more and more connections, and that is by learning a new language, learning a new habit, basically trying to learn something new every day and trying to reproduce it. That will increase the connections and help to improve the brain reserve. Thank you.